Hello friends, welcome to PMT2 channel. Friends, in last video we understood the concern of increased intracranial pressure in traumatic brain injury patients. Friends, in this video we will understand the role of Neurotol in reducing the increased ICP. We will also understand that how Neurotol is a better option than plain mannitol and other osmotic diuretic products available in the market. Friends, Neurotol is a research-based brand of Venus Remedies Limited, which contains a combination of two osmotic diuretics, that is mannitol and glycerol, 10% each, with the added advantage of VRP011. Friends, Neurotol is available in two packs, that is 100 ml glass bottle and 350 ml glass bottle. Friends, let us understand what is osmosis and how osmotic diuretics work. As we can see in this image, the beaker contains solution which is separated by the semi-permeable membrane. The left side of beaker contains low concentration of solute comparative to the solvent, and the right side of beaker contains high concentration of solute comparative to the solvent. In order to achieve equilibrium, the solvent from low concentration of solute moves to the high concentration of solute, and this process is known as the osmosis. Similarly, when we inject osmotic diuretics like mannitol and glycerol in blood vessel, the blood vessel now have high concentration of solute molecules. So in order to achieve equilibrium, the fluid accumulated in brain move from brain tissues into the blood vessel and effectively reduces the increased intracranial pressure. Let's understand the same process through this pictorial presentation, that how osmotic diuretics removes the fluid from brain and reduce the increased intracranial pressure. The osmotic diuretics like mannitol and glycerol reduces the increased intracranial pressure by performing three ways of action. The intravenous administration of osmotic diuretics increases the plasma osmolarity, thereby drawing water from brain tissues into the blood vessels and reducing the elevated intracranial pressure. After intravenous administration of osmotic diuretics, it also leads to the increase in plasma volume and reduced blood viscosity. Thereby, it improves the blood flow in brain and improves the oxygen level in the brain. Moreover, the increased osmotic pressure within the kidney promotes the production of urine by inhibiting the reabsorption of water and electrolytes like sodium. The same can be seen in this graphical representation. When we inject osmotic diuretics like mannitol, it starts moving along the blood flow. The fluid from the brain tissue starts entering the blood vessel and is excreted through the kidneys without getting reabsorbed. Friends, let's look at the reason why we say that the combination of mannitol and glycerol in Neurotol is made for each other. Friends, both mannitol and glycerol are the osmotic diuretics, and the ultimate goal of both the molecule is to reduce the increased ICP. But due to the different properties of both the molecules, they complement each other and produces fast action with very fewer side effects. As you can see that mannitol is the fast acting and glycerol is slow acting. Thereby, with mannitol there are higher chances of loss of essential electrolytes, while the slow acting glycerol restores and maintains the electrolyte balance. Similarly, with the addition of glycerol, the Neurotol avoids the rebound edema as it gets metabolized in the brain. Thereby, Neurotol offers faster action without electrolyte disbalance and without the concern of rebound edema. Friends, let us understand the role of magnesium ion rich VRP011 in neurotol. Many studies suggest that brain injury leads to the leakage of intracellular magnesium ions. And magnesium ions are non-selective NMDA receptor blocker, right? So during head injury, the NMDA receptors remain overstimulated, which can induce the neuronal damage or loss of memory and can also lead to death. Friends, the magnesium ion in the BRP011 act as the NMDA antagonist and help to reduce the neuronal damage as well as also preserve the learning and the memory. Thereby, Neurotol offers better cerebral protection and faster recovery compared to the osmotic diuretics available in the market. Friends, to understand the role of VRP011, let's see this in a pictorial presentation. As we can see that the brain injury can lead to the neuronal damage. In the absence of the magnesium ion, the NMDA receptor stays stimulated and that will lead to the further neuronal damage. So Neurotol contain magnesium ions in VRP011 which bind on the NMDA receptors and blocks its activity, thereby preventing the neuronal damage. Due to this, Neurotol helps in preserving the memory of patients and also facilitates the faster recovery of head injury patients. One more benefit with the Neurotol is that the brand is available in the glass bottle. Friends, majorly the plastic bottles used in osmotic diuretics are made up of polypropylene, commonly known as PP, or low density polyethylene, which is commonly known as LDPE plastic. Friends, glycerol is a very common plasticizer that softens the core plastic material. Thus, number and amount of toxic leachables increases in the formulation. Friends, based on the comparative study conducted to understand the harmful effects of plastic bottles, it is found that the concentration of bisphenol A, which is a toxic leachable, in the blood of the patient is found to be 12 times higher than the recommended concentration. And the concentration of dibutyl phthalate, which is also a toxic leachable, in the blood of patient is 2.7 times higher per bottle than daily tolerable intake. The findings of this study clearly support the fact that the glass bottle is safer than the plastic bottle in parenteral formulation and does not provide any hazardous effect to the patients suffering from head injury or the increased intracranial pressure. Also, friends, adding to the same, according to Central Drug Standard Organization guidelines, parenteral drug in plastic container cause patient hazards. As Neurotol is available in glass bottle, it ensures no toxic leachables which are commonly found in the osmotic diuretics available in the plastic bottles. So friends, in the end, let's summarize the facts based on which Neurotol should be preferred over other diuretics and plain mannitol. Fact number one, that Neurotol ensures rapid reduction of increased intracranial pressure, which is the primary requirement of every neurosurgeon dealing with traumatic brain injury patients. The second fact is that Neurotol avoids the rebound edema and also maintains the electrolyte balance. The third fact is that Neurotol prevents further neuronal damage and prevents the loss of memory, and it also facilitates the faster recovery of patients with traumatic brain injury. And the last fact is that Neurotol is available in glass bottle that ensures no toxic leachables which are present in plastic bottle osmotic diuretics available in the market. Friends, when compared with other osmotic diuretics brands, Neurotol is fast acting, safe, effective, does not cause toxicity, prevents the neurological damage, and also prevents the rebound. So why any mannitol? Ask your doctor to always choose Neurotol. Friends, in this video, we understood the role of Neurotol in reducing the increased intracranial pressure. We also understood how Neurotol is a better option than plain mannitol and other osmotic diuretic products available in the market. In next video, we will see the targeted indications, specialties of the doctors, dosage and administration of Neurotol. So friends, thanks for watching and keeping your brain active while watching. Have a nice day.